Welcome to On the Beat, everyone. I'm over here with Dr. Richard Hurd and Dr. Ricky Johnston, and of course they are from Gastroenterology Associates of Columbus, and today we're talking all about, don't be irritated everyone, IBS, Irritable Bowel Syndrome, correct? Welcome back to the show, gentlemen. We really appreciate it. All right, let's discuss what IBS actually is, and we'll go with IBS, the acronyms, yeah?
Yeah, irritable bowel syndrome. It's very difficult to say exactly what it is because a lot of it is symptoms outside of any other explanation. So, sorry, that's a little bit confusing, but we think that some people have sensitivity in their colon to certain foods they eat,
right.
And also it's affected by the bacteria in your intestines, so there's a lot of things that affect it.
Okay.
Mostly we're trying to treat symptoms with this.
I'm going to just go off script here a little bit. Do you think these things, IBS, has a lot to do with, like you said, one of our foods? If we go back to eating that Mediterranean type of diet or caveman type of food, less processed, which is the kick that I'm on right now.
Yes.
What do you think of that?
I think that would be beneficial for a lot of our patients.
Really?
We definitely tend to eat way too many processed foods and things in cans and boxes, and certainly cleaner eating I think would be beneficial to a lot of our patients. But we talk about, you know, dietary triggers, and it's tough because it could be different for everybody. Some foods may trigger some versus it may not trigger others. So we try to give people general guidelines regarding diet and hope that they can do some trial and error on their own and fine tune that to see what works for them.
Okay, so what are some of the symptoms? Someone's sitting at home right now, and I know it's like you said, it's hard to sort of determine, right?
Yeah, they're all very vague.
We're sitting
symptoms.
there and we're watching us, okay? What do they need to be feeling or experiencing?
Yeah, usually, well, three main symptoms that people have: abdominal, bloating, or discomfort.
Okay.
And then people fall into one or two categories, either diarrhea or constipation after that. And so for people some people go back and forth even between diarrhea and constipation, and that is a very difficult subset of patients to treat. Yeah, we do have medicines and things that we can do to
Okay, so
help.
is it an operation that one would need to have?
Oh, no, this is completely symptom-based treatment with medication. So
right.
there's as Dr. Hurd alluded to, there's not any, we would want to rule out any major alarm signs such as bleeding and weight loss and things like that. So generally it's going to be the symptoms he talked about, and treatment is really just focused on the symptoms, and so that's why he talked about alternating bowel habits being harder to treat, because we've got good things sometimes for diarrhea and we've got good things for constipation, but when people swing back and forth it can be difficult because you might swing somebody from one side to the other. So but we definitely have great medicines for both of the sides of that, and then people who swing back and forth, I focus more on diet and probiotics and things like that.
Literally I was about to say probiotics, because you know we've had interviews here with Dr. Robert, and he's, you know, all about the probiotics and making our gut healthy. But here's the thing, how do you know which ones to be taking?
That's a great question.
Yeah, we have some that have been studied. That's the important thing, is to know that the stuff that you're using is evidence-based and not based off of you know, this TV commercial you saw or this you know, my friend said. And if you come, this is all very complicated stuff. Come to us and we can help walk you through that.
And this is what I want to wrap it up with the interview: health and lifestyle, eating a good balanced diet. That's where you're really starting with this. What are you eating? What are your symptoms? And then you're fixing that. But along with the medications, I would assume you're saying, let's look at the diet, people.
Oh, both, definitely.
That's what's going to happen.
For sure.
I've noticed a big difference going a little greener myself.
Yeah, and eliminating gluten and FODMAPs. There's all kinds of diet options.
Well, guys, we appreciate you coming in again. Much appreciated. If you want to find out more, there it all is up on the screen, everyone. Dr. Richard Hurd and, of course, Dr. Ricky Johnston. They will take care of your IBS for you. Back after this short break.